Welcome to the Holistic Counselor Podcast. I'm your host, Diana, and today I'm excited to share a journey that began back in August of 2020 when I found myself completely burnt out, emotionally, mentally, and physically. Like many during that time, the pandemic, unresolved childhood trauma, my role as a therapist in an alternative high school, the heartbreak of teen suicides, struggles in my marriage, and even living in a house with mold left me in a deep state of anxiety and depression. It got so bad that I had to seek help from a psychiatrist for the first time. Now, I've always believed medication should be a last resort, not the first. So I asked Dr. Renata if she had any alternatives. That's when she introduced me to something called the Alpha-Stim, a cranial electrotherapy stimulator. She suggested I come in every day for a week to see if it would help. By day 3, I already felt a shift. And after that, I decided to get my own Alpha-Stim and use it daily. I also made sure to practice what I teach, going outside more, journaling, and making space for self-care. 4 years later, I'm happy to say I'm in a much better place. I hardly use the Alpha-Stim like I needed to back then, but it's still part of my toolkit. I've even used it with a few clients, and they loved it too. It's a fascinating tool that worked for me, even though I wasn't sure how it was working. That's why I reached out to the company behind it, Electromedical Products International, EPI, to bring someone on the show who could dive deeper into how this technology works. And today, I'm thrilled to welcome Ryan Gober, a medical science liaison with EPI. Ryan holds a PhD in translational neuroscience from the University of Miami School of Medicine, where his research focused on neuroinflammatory processes in neurological disorders like schizophrenia and Alzheimer's. His passion for non-pharmacological, I always say that word wrong, non-pharmacological, am I
You and the
saying?
rest of us, don't worry.
Treatments that offered personalized, effective care without side effects of traditional medication led him to EPI and their innovative device, Alpha-Stim. Right here, I have it, which offers drug free solutions for anxiety, insomnia, and pain. So let's dive in and learn more about how this non invasive brain stimulatory device could change the way we think about mental health treatment. So, Dr. Gober, thank you for being on the show.
Yeah. Thanks, Diana. I appreciate you having us on the show and for giving that really nice background too. Covered most of my background there to begin with, but
Oh,
really excited to be on the show today and have the opportunity to dive into a little bit more depth on the science behind our device, the Alpha-Stim product, as you were mentioning, and kind of go into some of our clinical data and
okay.
provide any questions that your listener or answers to questions that your listeners might have. And loved hearing your testimonial from using the device too. And, great story about, medications last, trying to look for non-pharmacological options first really resonates with my backgrounds and interests there. So yeah,
Yeah.
was happy
So,
to be here. And
I mean, I know you're a scientist, right? That's what you're, right. And so before going into the sciences, um, what made you go into that? Like what sparked your interest in this field in medical science and then
yeah,
working with a device like this?
no problem. So I guess it really, everything links back to childhood, right? Like I grew up here in Florida, actually up in Jacksonville, so kind of up the coast. I'm now in Miami, but grew up in Jacksonville, just next to the beach. We had a forest in the side yard and stuff, and so I was just always kind of a curious kid. Really, always loved to be outside, and really interested in marine bio and just kind of how things work. So I was always kind of scientifically minded there. Then as I got older, my classes during high school, nobody likes their classes in high school, but I always found myself doing really well in science and just, really loved all the courses I was taking, went on to college and just said, I love the research process, just getting to answer some of those questions that I was developing in a very methodical way. So really I've just had this long-standing passion for science, looking for answers, and led me to research. And, the research process is really exciting where you get to dive into specific topics and, you can spend years and years and years exploring one specific scientific
Yeah.
topic. But kind of what led me to wanting to work in industry and now with EPI was, you can spend all those years on a topic, but you actually want to see real world impact. So,
Mm,
I kind of always knew that I want to work in the drug development and med device development space, just where I can make like a tangible impact with my research in a way that's going to affect a patient kind of that next day.
okay.
So, we can dive into it a little bit more, but EPI was there. They had a product that was already on the market, FDA cleared for anxiety, insomnia, and pain. And I saw this great opportunity where I could continue to learn and research, but work with a device that can already be put into people's hands and start making a difference too. So that's
Oh,
my kind of roundabout, science
yeah.
background there, how I got here now. But yeah,
Okay.
I'm loving it so far too.
That's wonderful. How long have you been working for the company?
So I've been working there for almost half a year now. I
Okay.
just finished my PhD in neuroscience actually this past December of 2023. So yeah,
Congratulations.
thanks.
Wow. Okay. Yeah. I mean, my son is working on his doctorate in bioarchaeology.
Oh,
So, yeah. And
bioarchaeology.
yeah. So that's what I'm saying. I'm
Cool.
fascinated by scientists because I raised one. I swear he's like Sheldon Cooper and I'm like his mom in a way, but not that extreme on both ends.
Oh, that's awesome. So he was out there running around in the woods and on the beach digging stuff up too, then.
Yeah, exactly.
Probably have a
Exactly. And
lot to
so
talk about.
oh no, you two probably would get along great because he has a bachelor in neuroscience and behavior and two bachelors that he
Oh,
graduated at
very
18
cool.
with two bachelors. Yeah, that's what I'm saying. He's very intelligent in that manner, and I'm sometimes me and my husband and I wonder like how did he get that smart? But
Good for him. I just turned 29 and just finished the PhD, so he can run right past me before he's my age. So
we'll
that's
see. We'll
awesome.
see what happens. Yeah. But he actually had in previous episodes, people, if they've listened, will know that my son had a traumatic brain injury, and that's how I got really in 2012. He's doing well now. He'll be 26 in December, but he this whole brain thing, like this is why when Dr. Renato talked about Alpha-Stim, and I'm like, okay, I've studied, different things, and I know back when he had a situation, I was like, and I put it on him. I actually put but he didn't feel it. It was weird. Like I felt
Oh,
it like after one, and now this is where I'm wanting you to start explaining because
sure.
people are going, wait, after one. Well, this whole device, can you explain that some? Like why am I saying like I couldn't go past like 1.5 because I started feeling like I'm on a boat?
Yeah, so that's a really good talk track too. But so the devices you were mentioning, and for those listening, there's six different settings on it. So it uses it's so a little bit about the device before we jump into that
Yeah.
aspect too. It's a form of a non-invasive brain stimulatory device. So
Mm-hmm.
within that category of devices, we have a whole, list and range of devices that fall within this kind of non-invasive brain stimulatory category. You have electroconvulsive therapy, you have deep brain stimulation, DBS, TMS, transcranial magnetic stimulation, just a whole field. But Alpha-Stim is within a field that uses cranial electrotherapy stimulation, or CES. And it's a very low grade, low level of stimulation compared to some of those ones that I had previously mentioned there that use much higher levels of stimulation. But with that said, the device, as Diana was mentioning, uses six different settings of that microelectric current there, or cranial electric
Right.
stimulation. But each one of those settings is in the microamp range, so a very low amount of current, but everybody responds a little bit differently based on your sensitivities. We all have different physiological kind of builds and biological builds, but with the ear clips being attached to your earlobes, it's
Mm-hmm.
close to the vestibulocochlear nerve. So it's one of our cranial nerves that we know is very involved in balance and kind of that vertigo feeling you get. So people will have different levels of vestibular sensitivity, we like to say, where, we're trying to actually stimulate those cranial nerves. So, you want to be able to feel that rocking sensation before you tone it back down to a comfortable
Yeah.
level. But for
Right.
everybody, it's just a little bit different. We have a lot of veterans and Marines and military personnel that love to use the device too. And they're always challenging each other to pump the device all the way up to six. And it's like you can do that, but it's not quite necessary either. So we always
Right.
go up to that comfortable level that's kind of that personalized frequency for you.
Can you point, because this is going to be on video too. So for the listener that's on the it's listening, you can go on YouTube and actually see the video. Can you point to the vestibular? What was it called? Vestibular?
Yeah,
Yeah,
so it's
weird. Because I
for
have it
lack of
here.
better words,
Right,
you
right.
got your ear clips, right? And for
Yeah.
without going into a full anatomical dissection
Yes.
there, your vestibulocochlear is kind of further down your ear canal. So you've got
Okay.
your earlobes and then a little bit deeper through there. If you were to kind of put your finger through your ear, if you could
Ah,
keep pushing about
okay.
another inch or two, you'd be
So
at
so these two things go on the earlobe because oh, well, first you wet it down. You have this special stuff.
yes. Yeah, the conducting solution. So it's basically just a proprietary blend of solution there that's going to help that stimulation kind of conduct a little bit
Right.
more efficiently to the earlobe there.
Okay. And
So it's not
then,
contact.
yeah. And so then, because I'm the reason why I just want people to see how easy it is. Okay. And it's not a difficult thing. And I swear it's just like a little tiny, it became my best friend actually during all the stuff. And then you put it in and then it hits those nerves in the brain. And then, like he said, I remember them teaching me because I need specific, easy layman's terms words, right? The
Right.
stuff onto the ear things until you start feeling like you're on a boat and then you make one go back. So 1.5 was my sweet spot.
Yeah. And everybody has their own little sweet spot there. And we always emphasize, we get this question a lot too. We always emphasize to put it to a comfortable level. Like we know that it's a safe and effective form of stimulation. So you could go all the way up to the maximum setting. And it's going to be safe to use it at that setting, but
Oh,
we always encourage to use it at a comfortable level, largely because a lot of our clinical data that we have, and we can talk about a little bit more later on, but many of the clinical studies that were done with the Alpha-Stim device were actually done at a fixed setting, which might have been that 1 or 2 setting there. So we know that there's
okay.
been several studies done with the lowest setting possible of the device, and they still had clinical effectiveness. So
Wow. Okay. So more is not more, like, right?
yeah.
Like, because some people think like that's how we think sometimes, like, bee pollen, let's take a whole tablespoon and then all of a sudden you're puffed up because you should have started with one granular. Yeah.
Yeah, exactly. That's 100% it. And we always just lean back and say, you know what? We know that there's trial data out there where people use the lowest level possible on the device and still got the clinical benefit. So,
Okay.
you find your comfortable level, you might be able to get a higher therapeutic dose if your level is at 4 or 5 on that device. But if you're somebody that's sensitive to it, one is going to get it done too.
Right.
One done.
Yeah. Right. So let's talk about the clinical studies now. Like, when you say that, like, because it's FDA approved. I'm really impressed that it's FDA
Yeah.
approved, right? And how long did it take and how did you start? Like did you just go like where did the company go to say, "All right, humans, here we are. I need 10." Like how did it start?
Yeah, so it's FDA cleared for anxiety, insomnia, and pain. And on those original indications, the device has actually been around for several decades. And it's kind of one of the devices that, we think of a lot of modern pharmacotherapy or drug options that we have today too, started with, a compound that we found to be clinically effective and then work back from, right? So
Mhm.
Alpha-Stim was kind of the same exact category where the head scientist for the company, way back before I started, figured out that, electricity applied to the brain. We know that the brain is an electrical organ. You're using pharmacotherapy or drug options are largely trying to influence the way the electrical patterns in the brain themselves, just using a compound. So the founder basically said, what if we use electricity to interact directly with the neurons that we know are electrical? So
Mm.
it was kind of some trial and error, but they found a patented waveform that, like many drugs, tested it on humans and it had a clinical effect. And we knew it was safe from, preclinical studies, but once applied to humans, we're like, oh, it's reducing anxiety, kind of in the ways that we thought. And then since then, it's kind of been working backwards to figure out now how exactly does it work? Why does it work? And so the last 10 to 15 years have been really exciting in that category because our mechanism of action or how it works has largely been resolved too. So there's been a lot of, recent research that's helped us to understand how such a small amount of current is able to make those large differences in brain pattern activities.
Okay, do tell. Do
Yeah.
tell that I could understand it.
I
No,
know
honestly,
that's probably my like PhD scientific background, just jumping right into the weeds, but
it's
got to
okay.
tone it back a bit. But yeah, so you know, as I was saying with drugs, a lot of drugs that come out, you see a clinical benefit and you're working backwards to understand how it works. With this technology, saw clinical benefit, and we're working back to kind of find out like what in the modern day research could give us an idea of what networks or brain regions that we're interacting with that could help to reduce anxiety in the ways that we're seeing in our clinical trials.
Hmm.
And essentially, we found that there's been research over the past, especially 2 decades, that have pointed out this brain network known as the default mode network that's overactive in
Okay.
anxiety.
Yeah.
So the default mode network is largely it's several brain regions that all work together to kind of control how we have that like ruminative inward thought process. So it's
Hmm.
active when we're having that kind of self-reflecting, ruminative, like, you know, reflecting on yourself and how you're interacting with the environment. So that's healthy usually. If you're in a social setting or something, you're usually looking around and going, hey, how am I going to adapt to this, social setting that I'm in right now, making sure I'm saying the right things, reading how you're interacting with others, you're self-reflecting on your actions.
Hmm.
Now, in anxiety, that network is overactive, is what
Yes.
research is finding. So it goes from a healthy level of being like, hey, let me make sure I'm having a good interaction to, paranoid, looking around. I think everybody hates me, this crippling worry.
Hmm.
So we basically found that with research, given where the ear clip electrodes are, we're able to show with essentially a study, a functional MRI study, for a lack of better words, what brain regions we were hitting. And we found with this study that we were hitting a brain region that's largely involved in that network.
What was
Uh,
the name of the brain region? Because like
yeah.
what part of the brain?
So the temporal lobe.
Wait, is
So
that
it's
the?
one of the several, and
Yeah.
you can think about it, it's largely it makes sense given where the proximity of the ear clips are for it to be hitting that brain region, which is then involved in that network that we were describing.
Okay.
So I kind of like to use it for layman's terms as kind of the circuit breaker, because we know that all
Um,
these brain regions talk to each other. So if you can
mhm.
hit one brain region in that circuit, you can disrupt that overactive patterning a little bit.
Right. Okay. And so that makes sense because anxiety, insomnia, and pain, like they are all connected. Because when you're not sleep, like for me as a therapist, right? What I do, it's like I'm challenging the thought processes. I'm trying to get people grounded. I'm trying to get, tools after tools after tools and talk therapy. I'm a place where they feel safe to let stuff go from the past and stuff, but I'm trying to get them to function from this point forward.
Yeah.
Right, because the brain, what it does, it doesn't know that you're here or there, it just does, it's just right, it just turns on and then it's trying to keep you safe.
Yeah, exactly. It's largely in we're saying talking about it as you're saying, like a healthy process that's just out of whack in a condition, so to speak.
Right. So Alpha-Stim, what I remember, like I was highly anxious, that rumination, that over, and then it goes with depression. So it does say on mine insomnia and depression, but
Oh,
on this one, and because they are together, to me it's like these are symptoms, not, even though we like to diagnose it in my field, they are symptoms and your body's trying to wake you up or trying to get you, hello, pay attention, I need help, right?
right.
I mean, there is a level of anxiety and depression that is kind of normal, like sadness when someone dies, that's normal. Like,
Yeah,
because I get a little bit upset with my field because we like to just label it. And now we're actually disabling a lot of humans by saying you have clinical depression when I'm like, wait a minute, your dad died, you lost your job. This is
right.
normal. This is a normal feeling, like for what's happening.
Having to cope with it, but it's probably
Right.
not a clinical
Right.
form of depression. Like you
Right.
don't have depressed biology to begin with, or a
Right.
chemical imbalance that's
Right.
been there for long standing. So no, that's a great
Yes.
example of it. And for your device there that you might have, So Alpha-Stim used to be cleared for depression as well. But
Hmm.
again, with non-invasive brain stimulation being this up and coming field, there's been
Okay.
many iterations and kind of, overlooks of the data. And
Hmm.
what was basically found was that our strongest data was in anxiety. So we're
Okay.
exactly what you're saying with depression. We're largely targeting those anxious related pathways or comorbidities in depression as well.
Okay.
That's something
Okay.
I'd like to clarify there as well.
Yeah.
But as you pointed out, comorbid anxiety is such a big factor in so many other disorders,
Right.
including insomnia and
Hmm.
pain are other
Hmm.
two indication, those psychological aspects of pain especially. So,
Okay.
I myself, from my research background, am really, I would encourage anybody that's interested in the device out there at all to really look into our anxiety data because that's where some of the strongest, well-designed modern studies have been conducted in so far.
I love
So
that.
it's always ongoing, but
Yeah, I mean, that's what science is, right? Like you're questioning things constantly. It's not a just a one shot. Like, I mean, look at what happened with the serotonin reuptake and depression medication, and now they blew that out of the water with some of the science that came up. Going,
oh yeah.
so okay. So let's go back to the research a little more. It's been researched for how many years? Because I want the audience to really understand that this stuff has been researched
Yeah. So it's actually been around for research wise for about 3 decades now.
over
And
30
it's
years.
yeah,
Wow.
over 30 years. So the safety profile and if you go on the website and stuff, you can see all of the clinical research as well as preclinical research that we have over the years. And sometimes people point out and go, "Oh, that's a really old paper. It wasn't the strongest design study that was done back in the 90s. Why do
Mm-hmm.
you still have it there?" I'm like, "Well, it's really good to speak on the safety profile of the
Yes.
device. So you have all that safety data. We're just, expanding on the number of people that have used it throughout the years, seen clinical benefit, but most importantly, have proven the safety and the safety profile of it. But, since that time too, research has been ramping up, especially on the Alpha-Stim side, where we've had a lot more modernized clinical trials done, especially our what we say is our pivotal study or our kind of main study that was done in anxiety was back in 2014.
Mm.
So, research is a big mix. You get a lot of people that are conducting independent research with devices and stuff. You're getting a broad range of quality. So if people are interested in it, I always say to start with, that company's pivotal study first and work from there and use the
Okay.
rest as kind of supplementary materials.
So
But yeah,
all the studies and everything will be on the website, correct?
yes.
Okay, so I will put the website in the show notes for sure. So is there any kind of side effects that people might need to be aware of or like who might need to be cautious or avoid using it?
Sure. So we'll call it contraindications for providers. It's contraindicated or should not be used with implanted electrical devices that can't be turned off, which makes sense because it's still an electrical device and you don't want interference with a pacemaker, for instance.
Okay, thank you. I'm like, what do you mean?
It's not saying that we haven't seen a reason to, say that there might be a horrible effect there, but it's just this abundance of caution. You don't want it to be interfering with a life-saving device. So we
Right.
always say anything that's implanted that cannot be turned off. So in some cases, if you're using a different stimulator, we get questions about like spinal cord stimulators that can be turned
Mm.
off. If that device can be turned off while you use Alpha-Stim, should be fine. And then it's contraindicated against pregnancy as well. And that one's largely due to just kind of lack of research. It's
Okay.
very difficult to get
Right.
a trial designed and done in a pregnant population just because risk versus reward profile,
Hmm.
it's tough to get studies approved for that. So
Yeah.
those are the two main ones, but then the side effects, we always say they're mild and self-limiting. So those are going to be kind of skin irritation from the
Right.
electrodes, kind of that sensitivity. Maybe if you're somebody that has kind of eczema type symptoms, or gets kind of just breakouts from having ear clips on. That might be one side effect. And then just headache as well, too. So sometimes what will happen, and we'll see, treatment sessions are supposed to be 20 to 60 minutes, depending on what current level you're at. But we always encourage people to finish treatments because there can be this kind of dizzy, as we were describing earlier, kind of vertigo related sensation that can cause a little bit of anxiety and give you a headache. So we try to have people finish the
Hmm.
entire procedure until the very end, because that will resolve about halfway through it, we see, or at least with the patients that report that side effect.
Okay. So with the study, because I did see that this was a lot of veterans, like some of the videos and everything like that when I first, because I will before I put anything in my system, I really want to know about it before I take the plunge, like take and use it because I know I'm an electrical being, and I'm a highly sensitive person. That's probably why I can't go past 1.5.
Oh, wow.
Yeah. And so to me, like tell me about the veteran. I think there was a veteran study, or you have a lot of veterans, and how much it's helped them.
Right. So the veteran population is by far one of our biggest active populations that uses Alpha-Stim. So a bunch of our clinical research has been done in VA settings as well, especially for pain treatment. I think I might have sent you that 2019 retrospective study that was done in a VA clinic that was specifically looking at non-opioid alternatives for treating pain. So that's kind of how we got roped into that one. And so yeah, that population's extremely popular with them, largely because veterans, I mean, we can appreciate that veterans are going to be some of the most burdened by chronic pain,
Mm.
anxiety, and
Yeah.
a couple of other off-label indications that I can't go into, but lots of mental health disorders in that population's
Mhm.
chronic pain, especially interfacing with that. So it just seems to be a population that's benefited from it quite a bit compared to other groups. But I'm trying to think with veterans as well. We've just had a good relationship with the VA systems.
Mm,
Lots of great patient testimonials coming from them. So it
I
just
love that.
has been this positive collaboration, and we're still continuing to do research trials right now with some of those centers.
Is there any other populations, maybe like first responders or anything like
Yeah,
that?
exactly. That's another great one. We've actually been really pushing within the first responder patient, or yeah, I guess patient population at that level, but within first responder populations as well, we've seen some really great effects. And it's nice to for that group, we can appreciate again like the trauma related work that you're doing. If you're a first responder, as you mentioned earlier, especially during COVID times,
Yeah.
anxiety and insomnia especially are going to go hand in hand with that population. So we're seeing some really great uptake in that group. Yeah. And then the other thing with first responders and veterans too, for why it's been a popular option, as well as military service members, is because, those are populations that are looking for non-drug alternatives.
Right.
If you're taking a drug, especially in a first responder setting or in a military setting, it might affect your ability to do that job, or you have to be placed on medical leave for a
Mm,
period of time. So it's highly popular in those groups because if you can avoid taking a drug that's going to hinder your working capability in these hazardous settings or
hmm.
military settings, it's a great option to help reduce that medical load and then the operational difficulties it can cause as well by being on medications. So I think
Okay.
that's always worth highlighting with those groups.
Yeah, for sure. So is there any like populations, others like maybe women with anxiety or you know what I mean? Or like eating disorders, or I don't know. Are you guys going into that kind of trying to figure out how to study that as well?
Yeah. So in terms of specific, as I said, we have ongoing research right now and a number of
Hmm.
different topics, but and the ones that you just mentioned, maybe not as much, but I can speak on another topic that we're looking at, kind of going into a sub-classification too, is we are starting to look at younger populations, kind of the college age, older
Good.
adolescent. As we can appreciate, mental health crisis has been on the rise with younger college age kids right now and adolescents and young adults. So we have an ongoing study with UNC Chapel Hill Psychiatry Department looking at
Wow.
generalized anxiety disorder. So kind of a
Yes.
a more specific indication within anxiety within that 18 to 24-year-old population there.
I love that. I because
Yeah.
that's actually the population I work with a lot. A lot
There
of
you go.
18 well actually I have a lot 20 I would say 21 to 41-year olds that
Okay.
and a lot of them are I would say 80% are females with anxiety.
Huh.
Yeah. And
Yeah, well, I'm
so
sure we're running this large scale trial right now, so that will be an outcome measure that we can look at as well.
how do
It's
you
a
get part of your trial? You have to be seeing a psychiatrist at UNC or something, or you know what I mean? Like one of them to bring, is that how? Because sometimes they have national trials, like the
right.
psychedelic research at John Hopkins will say, hey, if you're willing to come up here. But for this trial with Alpha-Stim, is it just through UNC?
Yeah, so for this one, recruitment's run through
Okay.
that team there. It's largely in the regional area. So if you're in kind of that region and you're interested in a trial, I don't run our clinical trial there,
Right.
but you can absolutely ask a local provider and say, hey, I'm interested in the Alpha-Stim device. Heard there's a trial ongoing. Can I look at getting enrolled in that as well? So I know that they're still enrolling for that one up there. And yeah, that one's still ongoing. So we're hopefully going to have data from that one starting in 2025, where we can
Wonderful.
start to look at, enrolling over 100 patients plus is the target. So we'll be able to look at different factors, as you mentioned, gender in there, uh,
Hmm.
specific age groups, just comorbid factors. We're aiming to have EEG readouts too, to kind of start expanding on our mechanism of action too. So
Okay,
Aaron and me love that trial.
so that means that while they have the device, the little machines going like that means EEG.
So doing kind of a readouts before and after treatment to understand,
Okay.
to kind of bolster our evidence surrounding the default mode network, which brain regions are important, and just seeing, which pattern shifts led to the best clinical outcomes too. So
Okay.
kind of just trying to piece in all those little details that we had mentioned that research is always ongoing and trying to do.
Okay. So my question, if this has been around for 30 years, right? This wonderful little machine, why is it not known?
Yeah, so I think it was largely the field of non-invasive brain stimulation, or NIBS, we'll call it for short, has
Mhm.
been on the up and up for a long time. And I think it was just people were less familiar with it. It was a new technology way back when, and there wasn't as much research done at the time for how it works. And as I'd mentioned, in the last 10 or 15 years, we finally have the research techniques available to let us start studying how these technologies that have been around and have shown clinical effectiveness, how they're working. So I think that was one of the large reasons that there wasn't as much uptake for so long, just because it was just this fundamental understanding of how it worked that was increasing. So as I had mentioned, some major key findings that happened, especially in the 2008 to 2012 range in neuroscience.
Mhm.
There's always this question of how cranial electrotherapy stimulation, CES, or what Alpha-Stim is using, is a very small amount of current, which is
Mhm.
wonderful because it's safe. But there was
Yeah.
always the question of how is this tiny amount of current leading to such large scale changes in brain activity? And
Yeah.
some major findings in the earlier 2000s, or in that 2008 to 2012 range, there were great, like these really cool findings where it showed that by triggering one specific neuron in a pathway, so just one neuron, you could alter the entire brain network there. So just
That's
one neuron could alter an entire emotional pattern or brain pattern there.
wow.
So that was,
That
yeah.
That's pretty cool. And that's one thing I do work with my clients is rewiring the brain, right? Naturally, without wires, but just thought processes or like continually getting them to go from big time negative to, so I'm thinking this thing might help my clients and with what I'm doing too. Wouldn't that just rewire the brain quicker and faster, maybe?
Yeah, a little bit there. I mean, I think it can definitely be used. We have a great study that I can share with you as well that was
Mhm.
showing that using Alpha-Stim alongside psychotherapy to kind of boost those psychotherapy outcomes. And
Mhm.
I think it's largely because it's going to help people interact with their therapy sessions more. If I had to
Yeah.
guess, and you can, whatever thoughts you have, let me know as well. But I've always thought that if somebody's having anxiety before going into that therapy setting, maybe it's a first time, they're just enrolling in it for the first time. If you can help reduce that anxiety leading up to that session, I would imagine that you can get a lot more out of it if you're having a better interaction and not kind of getting in your own way.
Hmm.
So that's about the level of depth that I put those two together there so far.
Yeah.
In
No,
terms of biological circuitry,
right.
not as much there for me to speak on, but
Well, I love it too because to me it empowers the client. It's like I had to go to the office for the first few days to try it out, to check it out. And then once I saw that, oh, like by the third time I went, and there is the placebo effect. I'm gonna bring that up
yeah,
because that's how we are as humans, right? So to me, but I felt it. It's not like I was hallucinating it. I felt it, and then I felt the calmness and everything. But I also did other things to hurry up to because I'm a therapist. People were relying on me. This is my how I pay my bills, right? And so I had to
right.
get to a good space quickly, and that really helped me without me having to take anything anti-anxiety. But I took L-theanine. You know what L-theanine is, right? To calm. It's a amino acid, so it's like these certain things that I was really, you know. But that's the thing. Like every human has their own biology.
Right.
And
And we always say, like, speaking on that, every human has their biology aspect. I was talking to a provider a couple weeks back who had this really great line about it. I'm like, it stuck with me, but they're like, oh, I love Alpha-Stim because, if you take a drug, it's got a half-life. You ingest something, it's in your stream, it has a half-life, it takes a while to get broken down. So if you start having a bad effect, you're
mm,
kind of strapped into that roller coaster until the ride's over. Is like, I like Alpha-Stim because it doesn't have a half-life. If you start not enjoying it, you can unclip and you're done. So
yeah,
I think that that's one nice thing, like as a tool that it has to be able to have that rapid anxiety relief without the worry that if you're not enjoying your session, you're going to be stuck with those side effects for the next 4 to 6 hours or day or two or metabolic side effects, whatever. But
right. And that's
um,
another thing. Like that doesn't give you like, like we forget because we have our own, we take something and then all of a sudden, like you take caffeine, drink a cup of coffee or a Coca-Cola or something else. And the next thing you know, your whole system is going out of whack. And now you're trying to figure out what caused it. And then now you have side effects. And then you need more things for this to deal with the side effects. And here we are, like, and then let's not go with the opiate crisis like
yeah,
that right there. Like people were having pain, and now look at what's happened in our whole society. That breaks my heart, having to deal with those that, with the pain and everything. So to me, like, I would rather say, hey, okay, so I have a listener right now, right? And they're listening and they're like, what is this Alpha-Stim? Where do I get it? Do I go to CVS? How do I, like, where would I start? What would you say to them?
yeah, so it's prescription based. So if you're working with a psychiatrist or a psychologist that can, and a lot of times they'll work in reference with one another too. So even for therapists, you can often say, hey, you can go get this. If you go see a psychiatrist and ask them about the device, we have a form of medical necessity that they can fill out and basically get you the prescription for that device
Mm,
through those means. And if
okay.
you're interested in it too, I'm more of the like scientific and clinical background, so I don't have as much information on like the cost breakdowns and the
Okay.
different, I know there's rental plans available. Really just contact anybody at the home office and they can at least put you in contact with the right, we have some really great clinical support teams at the office who will walk a patient through exactly how to get it. They're on the phone 24/7 basically. Um,
Okay.
they'll walk through that process. But no, another thing I can speak on for that, I know that there is a 30-day money back guarantee. And, I'm not in the sales department there, but what I can speak on for that is I love that policy so far because
Mm-hmm.
if you check out our pivotal study in anxiety that I was describing, we saw our maximum clinical benefit at 5 weeks.
Mm.
So within that 4 week period, you're going to be able to find out whether or not you're a responder to the device or not, whether or
Ah,
not it's going to be an effective option for you before you make that cost, justification for yourself there.
okay. So, do you have a list of providers that are like Alpha-Stim friendly? You know what I mean? Because honestly, like I have people in the field and they're like, "What are you talking about?" They have no clue when I say Alpha-Stim, and so. How are you getting yourselves out there more with clinicians?
So yeah, so we have a list of KOLs or key opinion leaders. So these are all providers across the country that have been using the device for quite a while, have seen clinical benefit with it with their patients. So we have that list of providers that work pretty closely alongside us to,
Okay.
they'll work dinner programs sometimes. They'll hop on a guest webinar. So we'll do a lot of topical guest webinars, maybe once a month that, patients or providers, anybody interested can tune into. So if you're interested in those topics, feel free to hop on our kind of our
Hmm.
email listservs there. But yeah, they'll do webinars once or twice every month. I think we did one last month on use in first responders. So we had a psychologist who was previously a first responder who's been, using the device quite a bit. She's a huge advocate for it. So she'll
Wow.
hop on and give a webinar, but
I
so
love
we
that.
do quite a few of those. So we've got
Okay.
our roster of different providers across the country that are using it.
So it's only psychiatrists and medical doctors that can prescribe, or can anyone in the like me as because I remember in the very beginning 4 years ago, there was a thing where I was able to fill out the prescription form. I think that might have changed.
It varies from state to state. That's the other layer of complexity on this too. So,
Okay.
it's every different state has their own set of rules on it.
Mhm.
Sometimes you do have to refer through a psychiatrist, and then in other states, it's much lower barriers to entry there. So it's kind of a
Okay.
case by case scenario there, depending on what state you're in.
Okay. All right. So can a person just say they are seeing a psychiatrist already? Can they just say, "Hey, I want the Alpha-Stim. Will you can you and even if they don't know about it, you know what I mean? Like kind of push the psychiatrist like,
Yeah.
"Hey, can you?" Okay. I just was
Yeah,
wondering
you can
how.
ask as the famous drug commercials always go, you can ask your provider about
Okay.
RZ, you can ask your provider about Alpha-Stim, and generally, again, that maybe if they're not even familiar with it, like you can look into it and go, okay, this looks like a safe enough option for my patient. They're passionate about it.
Hmm.
We haven't had too much issues with pushback from providers just going, no, I don't want to give you that device or a
Okay.
prescription for it.
All right. Yeah. All right. That's interesting. All right. So as we're wrapping up, I just want you to share maybe one story or a person that that Alpha-Stim totally changed your life, that this is why you keep doing what you're doing. Like, is there anybody, or without naming them, of course, because of privacy and confidentiality? So, you know what I mean? Like, is there any where you heard that, like, oh my gosh, this is why I love this job as a scientist at EPI and I want to continue this work?
Yeah, so for myself as a medical science liaison, I'm kind of in this unique situation where it's like I have a PhD background, so I'm not have never been a provider, and then also I have to stick to like the research and data behind the device. So I don't have that powerful patient testimonial.
Mm-hmm.
There's members of our team and KOL roster that probably do, but what I can speak on for myself and why I'm really enthusiastic to be working here and in this field is that it goes back to kind of when I was finishing up my PhD, as we had mentioned in neuroscience, and I was studying schizophrenia. Basically, knew that I wanted to go into this career path afterwards as an MSL where I'm at now. But I knew in order to get the skills to do that, I would need to get more clinical exposure. So, not treating patients, but understanding the diseases I was researching. So, I
Mm,
participated in a lot of clinical shadowing, and as PhDs, we were always taught, let's find a drug to solve this issue. Let's find a
right.
molecule to treat this disease. So I was wired that way. But as I started clinical shadowing, I started to notice that, especially in schizophrenia, the non-pharmacological or non-drug factors were so much more important than I realized or previously realized for how those patients are going to do in the long-term outcomes.
Mm,
Whether that factor was the family network they had behind them, was an app that they were using to help manage their wellness and just overall mental health, or just their kind of life settings too. If you were in a comfortable setting, had that support network, you usually adhered to your medications better and had a better outcome. So I had a huge appreciation for non-drug treatment options. I'm like, wow, these are powerful. So
mm,
along comes EPI and Alpha-Stim, and I got really fascinated with, well, what other non-drug options are there that aren't going to have the horrible side effects I was witnessing in the clinic? And, Alpha-Stim has been this great option where it's kind of fulfilling all those boxes in my head as a research device or a researcher where you're seeing these clinical benefits, you're not getting side effects. And so I'm just really passionate about, even as a research background, like, okay, options like this, where we can limit the amount of medications that somebody's taking to help them get over this mental health barrier are
Mm.
incredibly powerful. So it's a field that I'm passionate about. I'm excited for where the next decade of research is going as well. We are working on a depression device as well, with
Wow.
technology, but yeah, it's just non-invasive brain stimulation has made major strides, and I don't think it's stopping anytime soon.
Yeah, no, I don't think so. It's and I guess what I'm thinking too, like we have so much electricity nowadays, right? Like just thinking about that this would calm it while we have towers right over our heads. That might
Yeah,
not be calming us at all. Honestly, like I'm always telling people to go outside and touch grass. I mean, honestly, like because we're human beings, we're not meant to be in this,
yeah,
forever 24/7, because that causes a lot of anxiety. So to me it's like go outside, touch grass, put on an Alpha-Stim, do your 20 minutes in the morning as you do breath work, right? Like why
yep,
not like incorporate, because to me, like for this podcast, I want to just find as many tools I can for the listener and make them understand that there are other ways to mental health,
right,
right?
exactly. There's other options. No, I think that that's awesome that you really hammer home those subjects, and you're a big advocate for looking at all of our options, especially non-drug options, before
Yes.
taking a whole cocktail of different medications to try to solve an issue that might have been solved with non-pharmacological options such as therapy. That was
Mm-hmm.
obviously the low-hanging fruit I forgot to touch on with my clinical shadowing, the ones that were going to therapy consistently. Maybe if you could do that or use a device that is going to help you interact with those therapy sessions better.
Yeah,
You don't
exactly.
have to take that medication, or you
Right.
know, obviously there's patients that still need to stay on their medications, but now
Mm-hmm.
maybe instead of taking three different ones, you can take one or
Yeah,
two. So
exactly.
yeah,
Exactly. It's trying to find your balance in a holistic way, and understanding that you are a mind, body, and spirit, and that we need each other. I mean, this is why we're on earth together, and we're not supposed to be these people like on our own island. And
yeah,
sometimes we feel like that, and that's is why it's important to understand like there are ways that we can learn from different communities outside of our ethnocentric American mindset. Mind you, I love being an American. I'm an American. But at the same time, we've created this very narrow-minded way of being and thinking, and a lot of people are suffering. And so this is why I came after you guys going, you want to be on my show? Because
really appreciating it. So it's exciting to be, hosted on this, and I'm just still elated that it's like I get to apply everything that as
yeah,
we talked about, that I learned for all these years, way too many years of school, into something that, I find really interesting, and I get to talk
yeah.
about it on a daily basis like this. So
Yeah. No, it's great. And it's great that you were able to come on and actually explain it in a way where someone like me can understand it better and more complete. I was just trusting it. And now I'm like, okay, that makes sense now. Oh, in the brain. Okay. And I'll probably go look up that part of the brain, the vestibular or whatever, because it'll come up on the transcript. So
yeah.
and is there anything you would like to share with the audience to encourage them before we say goodbye?
Yeah, sure. So I, appreciate anybody that was tuning in too, but I think from my end that if this is a topic that you're interested in, or the Alpha-Stim device itself, I definitely encourage you to kind of do some of your own research on it too. Look through our website, search up non-invasive brain stimulation just in general, and start combing through the research on your own. And if you're interested in it, start bringing the topic up with your providers more, because I think that this will be a field that is going to become larger and larger. So it kind of falls on us to start getting this word into the provider's ears too, so that
Right.
we can start to build more momentum. So,
Mm.
encourage you to do your homework, reach out to the Alpha-Stim team if it's something that you could find interesting. And thanks for tuning in.
Yeah, for sure. All right, listener, thank you for tuning in, like he said. And just remember to trust in the Lord, guard your heart, and renew your mind. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.